When someone comes to Park Meadows Cosmetic Surgery for evaluation of male breast tissue or gynecomastia, we start with a comprehensive physical exam, a history, and evaluation as well. Also important to understand the psychologic impacts of patients, how they've dealt with their enlarged breast tissue, either through high school, through college, or after that period of time. After that, there may be an indication to order certain labs to look for hormonal imbalances. Assuming everything comes back normally and that there's not medical treatments for gynecomastia, then we can sit down and really discuss the benefits, the limitations, and the risks of certain surgical procedures that can be used. Once the patient and the doctor decide on a surgical procedure and whether it's appropriate, then we progress with one more visit. We like to see the patients at least twice to solidify the surgical plan, check lab work, etc. And then we go to the operating room. We're a state-licensed surgical center, and we can help these patients here on premises. And the surgical, depending on the patient, every patient is different, the surgical procedure can last anywhere from an hour to 2 or 3 hours, depending on the severity of the problem. The surgery then is individualized to the patient, and then the patient goes to the recovery room and is discharged usually the same day, unless there's other procedures that are being performed. The recovery time varies between patients, but can be between a week to 2 weeks, and they often have a post-surgical garment to help shape the chest and help prevent any swelling. And then we see the patient multiple times post-operatively to make sure that they're doing well, that their desires were met, and that they don't need revision work or they don't need work on their scars, and just basically follow up as you would for any standard patient. Obviously, every patient is different depending on their chest. There are several surgical procedures that can be used in combination. Liposuction is one of those procedures, as well as direct excision of tissue. And so the answer often includes liposuction to improve results, or utilizes liposuction as the primary mode for treatment. So liposuction is a key procedure to address liposuction. However, it cannot fix everybody, because some male breasts are too big for liposuction alone, and it can be combined with surgical excision as well. The procedure is performed on premises at Park Meadows Outpatient Surgery. It is a state-licensed facility with 2 operating rooms and 2 procedure rooms. Typically, it's done in the operating room under anesthesia with a board-certified anesthesiologist. It is typically an outpatient procedure in which the patient comes in on the day of surgery and goes home the same day after surgery. Again, the procedure tends to last anywhere between an hour to 3 hours, depending on the severity of the patient and the severity of the chest wall problem, but typically we can get it done within 1 to 3 hours. The decision between 1 or 2 procedures often depends on the patient. We always like to try to minimize the number of procedures performed. In most cases, we can have this done in 1 procedure with good results. However, there are patients with, for example, massive weight loss patients, or patients with significantly enlarged breasts in the male, where a stage procedure can be used, such as a less invasive liposuction technique to shrink the breast skin. As the breast is reduced in size, the skin can sometimes shrink around that, and if it does not satisfy the patient, then sometimes they will need a second operation to actually physically remove skin. Again, we try to limit that, but it is dependent on the patient and really the size of the breast tissue that we're trying to tackle. The scars for male gynecomastia patients tend not to be a problem, with the exception of significantly large breasts. Depends on the technique that we use with regards to the scarring. Most patients, if they can get away with just liposuction techniques, they'll have 1 or 2 poke holes or small incisions about 2 to 3 millimeters, usually hidden in a shadow or a fold. For those patients who really need excisional techniques, where you use a scalpel to cut out breast tissue or cut out skin, then often a patient will need an incision around the nipple, which tends to heal well but can be seen, And sometimes they'll need a pattern that's very similar to female breast reductions, in which there's a nipple, an incision around the nipple, a vertical incision like a lollipop going straight down, and in some cases a horizontal incision at the bottom that looks like an anchor. Most patients, I would say, can get away with liposuction alone and can get away with multiple stab wounds and possibly an incision around the nipple. These incisions are hidden under t-shirts. However, some patients who want to walk around without a shirt on will have visible scars, but they tend to heal well in the male patient, and if they have hair on the chest, tend to be hidden as well. When picking a surgeon or a physician for any procedure, I would use the same criteria that I use for picking my primary care doctor or another surgeon for my wife, for example. And this would be someone with extensive expertise in the area of interest. Specifically for male gynecomastia, this is usually going to be the plastic surgeon or the surgeon trained in plastic surgery, and in some cases cosmetic surgery. The most important is to understand the qualifications of each surgeon that you visit, and understand what that training entails. Also, the more surgeons do of a certain procedure, the more likely their outcomes will be better and the fewer complications. And therefore, you need to really address that with the surgeon, whether this is something they've done once or twice or something that is part of their bulk of their practice. Again, plastic surgical trained surgeons tend to be in the forefront of this particular procedure. And we always evaluate board certification, and that's also an important aspect of qualified surgeons.